Okay. All right, Mr. Casey, so tell me a little bit about how your day-to-day life was prior to having back surgery.
Well, basically, I'm a very physically active person. I'm always busy doing something, always working on a project or constructing something, building something, repairing something, or taking something apart or whatever. But anyway, when I would do that, it would result in pretty intense pain in my lower back after I got to the stopping point on it. And then I would be faced with taking like ibuprofen or one of the painkillers and getting out the heating pad and having the heating pad on my lower back late in the evenings. Most typically this would be late in the evening. And then usually by the next morning I'd be okay, I'd feel all right, and I'd be back. This cycle would just repeat itself. I'd go back outside working, doing something, some project, and again it would result in pain, and then I'd take the ibuprofen, get on the heating pad. And so it was pretty much a vicious cycle, and it got to the point that I just couldn't, I really had to scale back what I could do, which is very frustrating. And for example, also I was very active playing senior softball in a league here in Denver when we lived in Denver. And I had to stop that completely because I just couldn't bend over. It was just too painful to bend over. So it did change my life quite a bit before I had the surgery.
Mm-hmm. So back then, before surgery, what was your typical pain level like day to day?
Okay, how it would work is I would start out in the morning basically pain-free, and then during the course of whatever I was doing or working on or whatever project I had, the pain would start creeping up, and then it would peak out probably on a scale of 10, I'd say probably between 6 and an 8, sometimes maybe a little higher, sometimes a little bit lower, but that would be kind of the end result of it.
So during that period of time, whenever you're dealing with quite a bit of pain, especially towards the end of the day, did that affect your mood, the way you interacted with your family, or the things?
It definitely did. It works on you mentally. You just feel like, you're just going to be limited to just sitting in an easy chair the rest of your life and not, reading a book or whatever, but not really basically doing the things you like to do when you're retired, since you're not working.
Yeah. That definitely can be very difficult.
Mm-hmm.
So at that time, were you needing to take any specific medications, or what kind of strategies did you use to deal with the pain?
Well, just basically in the evening I would start taking ibuprofen, and I had a little bit of a reaction. I had some negative reaction to that, primarily stomach issues, and the heating pad, and that's really about the limit of what I took.
And it sounds like you had maybe seen another physician, or did you have any back surgeries before that?
No, I've never had back surgery, but I have been advised over probably the last 20 years to have back surgery for the degenerative disc disease, and I elected not to do that. And I did have a friend who recommended me to a surgeon that she went to, that she was happy with, and I made an appointment with her, went to see her, and she saw the problem and correctly diagnosed it, but she said that in her opinion, she didn't want to operate on it. She just wanted me to do physical therapy, and I'd already done that 2 or 3 times, and it's kind of a short-term Band-Aid over a bigger problem, so I elected not to. And unfortunately for the lady friend that recommended this doctor to me, her surgery ended up being very unsuccessful, and she had to have a second surgery. So I'm sorry for her, but I'm kind of glad that I didn't proceed with the first course option that I had.
Well, I'm sorry to hear about your friend, and hopefully she starts to do better. As far as your diagnosis and your procedure, do you remember what your diagnosis was? Do you remember the procedure that you had done?
Yes, in my situation, it was degenerative disc. I'm pretty sure it was L4, L5, and S1 were the 3. And Dr. Patel went in through my stomach and fused those 3 those three vertebrae together. And his surgery was very successful. It totally fixed the problem for me.
Good. So it sounds like you had an anterior and posterior L4 to S1 back fusion.
Yes,
Okay.
exactly.
So I guess during this course, when you first came and saw Dr. Patel and came to the Spine Center here, what was your experience with the staff, Dr. Patel, and your overall, I guess, patient experience coming here?
Okay, yeah, it was outstanding. The staff is terrific. He has a great staff. Somehow he's managed to convey to them to put customers first, which sometimes gets lost in society nowadays. But every person, not a single person that I spoke to or was involved with or worked with in the course of from beginning to the end, they all did a fantastic job. They were great. They were responsive, helpful, encouraging, just went out of their way to bend over backwards. And especially Susie Estes, who's one of Dr. Patel's key employees. And my first appointment, I met with her first before the doctor came in, and she really put me at ease. I was pretty nervous on that first appointment. I didn't know if I really wanted to go through with this or not. And she answered all my questions. She's easy to talk to. She's helpful. She's informative, extremely knowledgeable, and just a great lady.
Well, good. I'm glad that was a good experience for you. So let's talk a little bit about the surgery, the day of surgery, coming in, and how it was in the hospital for you.
Sure. Well, I came in early in the morning, reported in, and they immediately started all the process of the paperwork and getting me set up for the surgery. And then, of course, after the surgery, when I came to in the recovery room, I was pretty groggy and everything, but actually felt fairly good considering. And I was a little bit surprised that I didn't have more post-operative pain for the days that I was in the hospital. I took a minimal number of the narcotic painkillers because I don't like doing that. And I immediately started walking in the hospital. And all of the staff again in the hospital, they just went out of their way to be accommodating, to be understanding, to answer my questions, to help me in any way. And it just made it so much easier as being on the patient side of things to know that you could get that kind of help.
Good. I'm glad that was a good experience for you. So let's talk about now. How are you doing now? How does your back feel? How's your pain level?
Okay, my pain level now is very minimal, and I need to qualify that. I only have it if I do tend to get out and maybe overdo it a little bit, exert a little bit more physically than I should. And I'm pretty well convinced that if I didn't do anything, if I just never left the house all day, my pain level would be zero. I basically wouldn't have any pain. I very rarely take any kind of pain medication like ibuprofen, or very rarely use a heating pad or anything like that. It's pretty much, I would safely say easily I'm 95% better after the surgery, and again that other 5% would probably even go away also if I just could sit still and take it easy, but that's hard for me to do.
Yeah, well, I get it. So I guess, can you talk to us a little bit about what your day-to-day life is like now, and maybe compare to that how it was before?
Well, I'll tell you what, I can do pretty much anything I want to do with limits. I try to not lift heavy objects. And we moved from the Metro Denver area, Arvada, to the little town of Buena Vista in central Colorado. And I've had a lot of chores, a lot of tasks, a lot of projects pertaining to the house move. And we've had a lot of contractors in the house doing upgrades and remodeling and things like that. And just the move itself was monumental because we've been in the house in Arvada 32 years. So it was a pretty big task, the move itself. And I've just about got all that stuff completed now, but I can pretty much do what I want to do. I like to get out and hike, exercise, you know, hunting, fishing, four-wheeling, all that kind of stuff. That's kind of what I like to do, and I don't have constraints on doing any of that. I can do whatever I want.
Good. Glad to hear that. So, if you came across a patient that had a similar problem that you had, and you were able to talk with them, what kind of advice would you give them about this?
Okay, what I would tell them, Dr. Patel is a fantastic surgeon. He's definitely one of the top surgeons, in my opinion, in the country, and believe me, I've researched him a lot, and he has an incredible reputation. He's got an incredible staff. He just gets it. He understands the complexity of back surgery, and I have so many friends and acquaintances that have had back surgery, in some cases as much as 4 or 5 times, and basically every time they had back surgery it was worse than it was before the surgery. And Dr. Patel just does it right. He just knows how to do it. He's great at what he does. He's excellent at explaining things, giving you a detailed description of what he's going to do and how it's going to all work. And he even says, you know, you're probably not going to like me too much the first day or two after the surgery, but you'll get over it. And I did. I got over it. And actually, as I said earlier, my pain in the hospital post-operation was actually considerably less than what I was expecting.
Good.
And I was up and walking around, and then when I got home, I was walking all the time.
Good. I guess to close, is there anything that you would like to say to the care team that helped get you through this process?
Absolutely. Dr. Patel and his entire staff are just phenomenal. They go out of their way to be helpful. They do a terrific job. They're just true professionals across the board. I think that's probably the best thing you can say about a medical person, to say they're a true professional. They know what they're doing and they do it. They take care of you. They're concerned about you. They're helpful. They're responsive. They're informed about what's going on. And I would highly recommend that anybody, I put my surgery off probably 20 years, and it probably did nothing but just get worse over time. But if you just go ahead and get it done, I think you'll be much to the better. And yeah, there's a little bit of a recovery period involved, and it takes a while to get back on your feet and everything. But once everything settles down after 2 or 3 months, you're going to say, I'm really glad I got this done, because it's just not fun having back pain. It just inhibits you doing the things you like to do significantly when you have chronic back pain with everything you do.
Yeah. Well, that kind of concludes everything for us. I want to thank you for taking time out of your schedule.
Sure.
And I guess that's it.
Okay, thank you.
Let me go ahead and turn this off here.